which is showing promise for the lady to have her own child even after one. There's something called ovarian rejuvenation which is taking place. We inject some hormones like.
Is there any emerging treatment for sub-fertility that shows promise in your field?
Yes, some things which were previously thought that it is just not possible, like a lady who has lost her uterus. Maybe congenitally, when she was born, she didn't have a uterus, or because of some disease process, she has lost her uterus. Uterine transplant is a new thing which is showing promise for the lady to have her own child even after once she has lost her uterus. Then the ladies who have attained early menopause or they have very reduced number of eggs in their ovary, there's something called ovarian rejuvenation which is taking place. Now, lots of new techniques, lots of new advancements are coming up, and they will definitely be a boon to the sub-fertile couple.
Ovarian rejuvenation, what exactly is that?
We inject some hormones like platelet-rich plasma or another product called GCSF into the ovary. And we try to enhance the number of eggs into the ovary.
And that's going to be short term or is it long term?
No, it's for short term that there's a little increase in the number of eggs so that we can retrieve that egg, make the babies and give the lady her genetically own child rather than going for an egg donation, taking egg from someone else and then having your baby, which will only have half of the genetic material from both the couples. So at least this way she can have her own genetically own baby.
So there's not a substantial increase, but a little bit seen.
Yeah.
Okay. That's very, very helpful though for a lot of couples.
Yes, it is. For the people who are, because of some genetic region or someone who has undergone a chemotherapy or a radiotherapy and their number of eggs have substantially reduced. I think even if we get 3-4 eggs of her own and we can give her genetically her own baby, I think that will be a good thing for the couple.
When we talk about eggs, a lot of big stress is laid on the number of eggs. Question is, number of eggs, quantity versus quality. Which one is more important?
Definitely quality. Because in a condition called PCOS, that is polycystic disease, we retrieve a lot of eggs. The person usually has got an infertility because she has an excess of eggs in her ovary. So in that condition, even when we do IVF for this patient, usually we do retrieve a lot of egg from the female, but the quality of egg is not good. So finally the babies which we make, the embryos which we make are not of that good quality and they don't go and implant and it does not result in fertility. The most important thing is quality. Secondly, because of the quality, if the quality of egg is good, we are going to have chromosomally normal embryo. If the quality is not good, then we might have chromosomally abnormal embryos which are formed, and then they will not even implant. They will not sit into the uterus. So the quality of eggs is more important than the quantity of eggs.
That's crucial information. For example, due to unfortunate reason, somebody's menstruation stops very early. She has got 0 egg. What are her chances?
If that is the condition, we can try for something called ovarian rejuvenation. But in case that also fails, then the only solution for that lady will be to have an egg donation, that is take an egg from a healthy donor, make the babies with the husband's semen, and that can be implanted into her uterus. So at least he will be bearing the baby for 9 months. She will be giving the birth. So she will have that fulfillment of motherhood and womanhood.
But the genes will be missing.
Her genes won't be there, yes.
Yes. When a couple is going through sub-fertility, women are mostly blamed. However, looking beyond that, what are the effects your sub-fertility journey has on a couple? Mentally, physically, and even in the relationship dynamics?
It plays a major effect because see, both the partners are more demoralized because of this factor. And there's lots of social and family pressure on them. India, to at least immediately after marriage, within a year, everyone starts asking, why are you not having a baby? Is there a problem with you? Every day hearing the same thing from your neighbors, from your family, it definitely demoralizes. It affects their personal life, their professional life. It has a major effect.
And I guess the romance also goes out of the window because then lovemaking becomes a technical thing when you have to time it and everything.
Everything is timed, like everything is according to the clock. Every cycle, the lady is sitting with the kid to check, now I have ovulated, now I must stay with my husband. And the disappointment when the period comes in that cycle leads to lots of break in marriages, lots of counseling is required. It's a big problem.
Yeah. In spite of not getting pregnant, they are suffering a loss. They're grieving, they're mourning a loss.
Yes. If someone can sit, not necessarily a doctor, if someone can sit and talk with them, maybe their friends or their relatives, their parents, their sister, brother, I think that will help so much.
So then the next question is then, do we have beyond family and friends, do we have trained counselors available in good number?
Yeah, as new ART rule, every ART center has to have a counselor.
Mhm.
And we have counselor trained into this.
Amazing. What advice would you give to a couple or to somebody who has been diagnosed with sub-fertility? Because I'm sure a lot of shock and this cannot happen to me while I'm feeling aata hoga.
The only advice or the counseling I would like to give is, as I initially said, there's nothing like infertility. There is a treatment to everything. Go to a good doctor and share your problem, because sometimes people are so ashamed of coming out with their problem. So please go and discuss it with someone. Go to a good doctor. Try and take help, and you will definitely succeed in getting a baby of your own. So don't be demoralized. There is a treatment, there is a solution to every problem.
That's wonderful to hear that there is a solution to everything. The feeling shame, ashamed, and guilty thing, why does it happen? I don't understand it. Isn't it just another disease?
Actually, since olden days, I think pregnancy has been taken as a very natural thing. So when it happens, it is actually not a disease, I would say. That is the thing. Once you label it as a disease, then people are ashamed of sharing it. It's a problem, and that can be solved.
Solvable. And I think for a lot of couples, like you mentioned, their surrounding situation makes so much of a difference.
Yes.
I remember my cousin's sister when she got married. She said everybody's attention was on her stomach the first year.
Yeah, that is right. That pressure adds on to the problem.
I mean, does that pressure fall on men also? Or is it more pronounced in women?
I think it is more pronounced in women, but then a couple is like two wheels of a scooter. So if one gets disbalanced, the other cannot go ahead without the one. So that will finally reflect on the other couple also.
Mhm.
If the lady is not happy, she's going to take out her aggravation on the husband only. So it is going to reflect on him also.
So true. If I may ask, has there been one particular case that has really impacted you in your field?
I think every case is different. And somehow during this journey, we actually emotionally get attached to all our patients. And our patients also are emotionally so much attached to us, whether it's a positive result or a negative result. The patients I have treated, I think 10 years back also are in touch with me today also. Every case is different. Every case has its own challenge. But I think if we can give them a positive result, that is what is
And
important.
I think that's what makes you a good doctor, being emotionally attached to your patients also. Because something as sensitive as sub-fertility, you need a lot of emotional intelligence, I'm sure.
Yeah, you need to connect with your patient.
Yes, exactly. Otherwise,
well, then only they'll open, they will tell you what exactly is happening, not only the medical part, the psychological part, everything they'll come out and share with you.
There is a repetitive statement that I see across from different doctors, and they say that a lot of male patients do not want to come for treatment. What is your opinion? Why do you think that happens?
No, because somewhere they feel that is a blow on their manhood. If you tell a male that the problem is in you don't have sperms, or the level of sperms or the quality of sperms is less in you, then he feels a little less manly. I don't know why, but it is definitely there. So you will see most of the patients with sub-fertility, the women is one who's coming to your OPD or your clinic for the treatment. And even if you tell them that now you have to get your husband also investigated, he'll come and say, I am absolutely all right. I don't need any investigation. I think our society is like that. I don't know whom to blame, but this is a condition in, I think, most of the clinics that we come across.
In your opinion, what should we do as a society to bridge this gap? Because it's definitely not something to do with your manhood.
Yes, definitely. We have to educate them. Let's see, it is not one person's baby. Like when a couple comes to me and their first question is, Madam, problem kisme hai? So I tell them the problem kisme hai is not. The baby is going to be of both mother and father. So I can't say that the problem is one person. See, even if there are so many patients, when the lady is ovulating, her tubes are open, the husband's semen count is good, still they are not conceiving. So you can't pinpoint the blame on one person. So similarly, we all should be supportive of the couple. And like I said, the stigma should not be pinned to the women. And we have to make them aware of this thing, that making the baby is the business of both of them. It's not only that lady can alone make a baby.
So true, so true. This has been so insightful, Dr. Seema. I have one last question before you go, and I'm not sure how you're going to take this. However, you've purchased Androwash from us. I wanted to get your feedback on Androwash machine by Subha.
Oh yeah, actually my residents, my PGs, they are using it more than I, because I know how to make the sample with the centrifuge also. But it is definitely very user friendly, and even a resident level who are not trained into infertility can make the semen sample with that machine, and the sperm quality is pretty good.
And have you had any success using the machine?
Yes, I have had successes. Yes.
That's amazing. We are so glad that you found success. It's our passion and our prayer that you continue to find more success. And from Subhak, we wish you the best in whatever you do. All right. Thank you so much. Have a very pleasant evening.
Bye-bye.
Bye-bye.